This podcast is for educational and informational purposes only and is not medical advice. Peptides discussed are not approved for fertility treatment in most cases, and you should always consult a qualified healthcare provider before making any decisions related to your health. Alright, so today we are diving into something that a lot of people are curious about, but not a lot of people are talking about in a clear, real way, and that is peptides and fertility. This is going to be a deep but simple walk through how peptides may influence fertility, how they interact with your body, and what people are actually trying when they go down this path. So, let's start with the big picture. Fertility is not just one thing. It is not just hormones. It is not just ovaries or sperm. It is a full system. You are talking about brain signaling, hormone balance, mitochondrial health, inflammation levels, blood flow, nutrient delivery, and even stress response. All of that has to line up correctly for fertility to work well. And this is where peptides get interesting because peptides are basically signaling molecules. They are small chains of amino acids that tell your body what to do. They do not replace hormones in the traditional sense. Instead, they influence how your body produces, regulates, and responds to those hormones. So instead of forcing something, peptides are more like nudging your system back toward balance. Now, when we talk about fertility, we need to separate this into two categories. One is female fertility, and the other is male fertility, because the mechanisms are different even though some overlap exists. Let's start with female fertility. At the core of female fertility, you have the hypothalamic pituitary ovarian axis. That is your brain talking to your ovaries. The hypothalamus releases signals. Those signals tell the pituitary gland to release LH and FSH, and those hormones tell the ovaries to mature follicles and ovulate. If that signaling is off, everything downstream is off. One of the peptides people look at here is kisspeptin. Kisspeptin plays a direct role in triggering the release of GnRH, which is what starts that whole cascade. So if someone has issues with ovulation or irregular cycles, kisspeptin is sometimes explored because it works right at that top-level signal. Then you have GnRH analog peptides. These are more direct, and they essentially mimic the body's natural hormone signaling to stimulate LH and FSH release. These are closer to what you would see in clinical fertility settings. But beyond that, there is a whole other layer that people overlook, and that is cellular health. Your eggs are extremely dependent on mitochondrial function. The mitochondria are what produce energy inside the cell. If your mitochondria are not functioning well, egg quality drops, even if hormone levels look okay on paper. This is where peptides like MOS-C and SS30-1 come into play. MOS-C is known for improving metabolic efficiency and mitochondrial signaling. It helps your cells use energy better. SS30-1 works directly on the mitochondria to reduce oxidative stress and improve their function. So instead of targeting hormones, these peptides are targeting the quality of the environment that your eggs develop in. Now, let's talk about inflammation because this is a huge factor. Chronic inflammation can disrupt ovulation, damage ovarian tissue, and interfere with implantation. A lot of people dealing with fertility issues have underlying inflammation and do not even realize it. Peptides like BPC-157 and TB-500 are often discussed here. They are known for their healing and anti-inflammatory properties. BPC-157 in particular has been studied for tissue repair and blood flow, which could potentially support the reproductive system by improving the environment around it. Again, these are not direct fertility drugs. They are supporting the terrain, which is a completely different way of thinking about it. Now, let's shift over to male fertility. Male fertility is largely about sperm count, sperm motility, and sperm quality. And just like with female fertility, this is not just about testosterone. It is about the entire system. You have signaling from the brain, you have testicular function, you have oxidative stress, and you have mitochondrial health in sperm cells. One of the peptides that comes up here is HCG, which is technically a hormone but often discussed alongside peptides. HCG mimics LH and stimulates the testes to produce testosterone and support sperm production. Then you have peptides that influence growth hormone like CJC1295 and ipamorelin. These can indirectly support fertility by improving overall hormonal balance, recovery, and cellular health. But again, one of the biggest factors for sperm health is oxidative stress. Sperm cells are extremely sensitive to oxidative damage. If there is too much oxidative stress in the body, sperm quality drops quickly. This is where mitochondrial peptides like SS31 and metabolic peptides like MOS-C can play a role because they help reduce that stress and improve energy production at the cellular level. Now, here is something that is really important to understand. Peptides are not magic. They are not a shortcut. They are tools that can support your body, but they work best when the fundamentals are in place. If someone is severely dehydrated, not sleeping, eating poorly, and under constant stress, peptides are not going to fix fertility issues on their own. You have to look at hydration, nutrition, sleep, and stress first. And I want to pause here and talk about hydration, because this is one of the most overlooked things, and it matters more than people think. Every single process in your body relies on water. Hormone transport, nutrient delivery, cellular communication, all of it depends on proper hydration. If you are living off soda or not drinking enough water, your body is constantly playing catch-up. That alone can impact fertility in a noticeable way. Now, let's talk about stacking, because this is where people start to get curious. When people use peptides for fertility support, they are usually not using just one. They are combining them based on what they are trying to target. So a typical approach might look like supporting the top-level signaling with something like kisspeptin, supporting mitochondrial health with MOS-C or SS31, and supporting tissue health with something like BPC-157. But again, this is not something to just jump into blindly. Timing matters. Dosing matters. Individual response matters. For example, with female fertility, timing around the menstrual cycle is critical. You cannot just take something randomly and expect it to align with ovulation. With male fertility, consistency over time is more important because sperm development takes about 70 to 90 days. So anything you are doing needs to be sustained over that period to actually see results. Now, let's talk about expectations. One of the biggest mistakes people make is expecting immediate results. Fertility is not instant. It is a process. Even in optimal conditions, it takes time for eggs to mature and for sperm to develop. So when you introduce peptides, you are influencing a process that already has a built-in timeline. You are not flipping a switch. You are improving the environment over time. And that brings me to something that I think is really important. A lot of people focus only on getting pregnant, but they do not focus on the quality of that pregnancy. Peptides that support mitochondrial health, reduce inflammation, and improve overall cellular function are not just about conception. They are about creating the healthiest possible environment for development. That is a completely different mindset. Instead of asking, how do I get pregnant as fast as possible, it becomes, how do I create the best possible conditions for a healthy pregnancy? Now let's talk about risks and reality. Most peptides used in this space are not FDA approved for fertility. That means there is limited long-term human data, especially in the context of pregnancy. So if someone is actively trying to conceive, or especially if they're already pregnant, extreme caution is needed. This is not an area where you want to experiment without guidance. And I want to be very clear about something. There is a difference between supporting your body before conception and introducing compounds during pregnancy. Those are two completely different conversations. Most of what we are talking about here falls into the preconception support category. Now, let's zoom out for a second. If you look at fertility through the lens of peptides, what you are really looking at is optimization. You are optimizing signaling, optimizing cellular energy, optimizing recovery, and optimizing the internal environment. And when all of those things improve, fertility can improve as a result. But it is not guaranteed, and it is not one size fits all. Some people respond really well. Some people see minimal changes. And for some, the underlying issue may require medical intervention beyond what peptides can offer. So the smartest approach is always a combination of both worlds. Use medical guidance to identify what is actually going on, and then use supportive tools, whether that is peptides, nutrition, or lifestyle changes, to improve the overall system. Because at the end of the day, fertility is not just about one pathway. It is about everything working together. And peptides, when used correctly, are simply one way to help that system communicate better, function better, and recover better. This podcast is for educational and informational purposes only and is not medical advice. Always consult a qualified healthcare provider before using peptides or making decisions related to fertility or reproductive health. Thanks for listening, keep learning, and stay curious.